going to get started on my session here. So my name is Karako. I am a doc student with National Louis University. I have a master's degree in school counseling, and I've been also, just as a side note, I had been a coach for cheerleading and gymnastics for close to 21 years. So this talk with the athletes and everything is very personal to me. I still do teach some athletes. I do not do as many as I used to, but I am still involved, and I have many friends that are involved in athletics as well. So with that being said, this talk, what it's going to be covering is competing in a pandemic and the effect of COVID-19 on student athletes. So the focus here is going to be, you know, how this pandemic has been affecting athletes, both, you know, high school and more, not necessarily professional athletes like, you know, NFL or NBA, but college athletes, more on, you know, kind of the Olympic kind of sports. So these are my objectives for this session, this talk, is, you know, just kind of identify where the needs are for the students. You know, what are they needing, what and who's needing it and why. Also, you know, we're going to be talking about, and I'm going to be giving some ideas, some strategies of what we can do to help these particular, you know, athletes out. So, you know, what is the problem, how it is affecting students, and strategies to solve. So obviously COVID-19 has had an effect on just about everybody, every industry, everything. This particular, you know, conference, we are meeting virtually. That is mostly primarily a result of COVID-19. So there has been, you know, a lot of focus recently about students and in the schools about returning into in-person learning and all of that. But there has also there's been some focus, but not as much focus on, you know, returning to other activities as well. So, you know, the schools, they were returning virtual, but you can't do virtual sports. And, you know, for some of these students, that is a major part of their life, especially, you know, when you're getting into high school and college. Some of these students, depending on what sport they're in, they might be training, you know, at an elite level, maybe training for the Olympics. You know, the Olympics got delayed another year. So, I mean, these are having major effects on our athletes, you know, on top of the normal learning and all the problems that we're having with, you know, returning to in-person learning. So this is just kind of something that, you know, it's having a major effect, and not a lot of attention has been paid to that. There's been attention paid to the professional side of things, you know, the NFL, the NBA, the NHL, and MLB. When are they coming back? You know, things like that. But again, the focus hasn't been majorly on that. There was a little talk when, you know, the Olympics were delayed for a year, but not much else has been, you know, focused on student athletes in college and in high school. So some of the effects that the students are seeing is, everybody was suddenly forced to have to be in isolation. And I mean, just normal people were having major effects of, isolation, depression, anxiety. Um, and so, these athletes are reporting the same thing, you know, increase in the isolation, disconnection, anxiety, depression. So they are feeling these as much, and sometimes in certain cases, they might be feeling it more than some of the normal, students in the schools. So, just some other effects, which me personally, I have seen. I work currently as a crisis counselor, and this data is showing it. There's been an increase in youth, of suicidal ideations and suicide rates. They have shown that this is just a difference from 2019 to 2020 in the same months, just 1 year difference, and they're showing a great increase in cases of the youth showing up in the ERs and everything, reporting suicidal ideations or attempts. So this is definitely a sign that there is something going on, and the youth are being majorly affected. Sometimes, again, more than what some of these others might be seeing, and adults. I mean, we're all having the effects of it, and we a lot of adults are having suicidal ideations as well. But I mean, this is showing major increase. Um, so, and this is one example. Lou in 2020 conducted, a survey with the average age about 16 to 17, and they were reporting, that at least 93% of them had a cancellation or postponement of an event or a meet or competition. 90% of them expressed feelings of isolation and disconnect. 79.1 reported anxiety, depression, and feelings of frustration. And there is also a high number that are reporting concern that it's still going to affect during this year's season, and it still is being affected. Their season is still being affected this year. And we'll talk a little bit further about that of how this is still going on and how they are being affected. So one way that these athletes have been affected is, we heard about all the cancellations of, the games, especially there was major concern or major publicization of the football programs. Whether or not the college football, NCAA was going to be having a season, what was going to happen to NFL. The NCAA basketball tournament last year was canceled. So those got major attention. The things that did not get major attention are some of these examples of certain programs that, due to COVID and budgetary cuts, because of their lack of financial income from programs like the football, basketball, things where they would have a lot more spectators, they are cutting programs. They there's examples. University of Minnesota cut their indoor track program, and indoor and outdoor men's track. The men's gymnastics team And, these are not just cut for the season, they are being cut permanently now. So, like I said earlier, that I have, kind of a personal connection with this. I do have many friends, and I was personally a gymnast. So, with the gymnastics programs, there were very few men's gymnastics programs in NCAA as it was, and now because of COVID, there are being even less, and these programs are being permanently cut. Also, smaller programs like swimming, diving. So these are athletes, that are training. Some of these athletes are training at Olympic levels and might be, training for the Olympics and have been in the Olympics. And now these programs are cut, and the athletes, don't have anything else to go to. This is where they were training, and it's also affecting their other training. But these are examples of some of these universities that have cut, and there's even a growing list still. This is not a full list of everybody that has cut programs or anything that has been cut, that is affecting it. So, they are, like I said, many of these sports are the Olympic sports. These sports usually do have a higher cost with a lower roster, and they have been back and forth, previously, on whether or not universities were going to keep them, and because of the cost of having the sports. And a lot of these also are affecting some of the women's sports as well, that some of these programs in everything are smaller programs, and again, they are being cut because of that. So now these athletes are not just being isolated from having to deal with COVID, but now they are losing their whole reason, for some of them, for going to that college or university. They had had scholarships to be part of these sports teams and programs, and now they have nothing. Also, again, they were training for Olympics in some cases, and now they don't have a facility to train at. They are not able to continue to train due to the programs being cut. And as a side note, these sports, they are generally predominantly white or with foreign athletes as well, and so that makes a greater impact, and with diversity as well, that these sports had some diverse populations and rosters, and now they again, they are being cut. Some could be also international students as well. So now the reason for them coming to the university and training and getting the education here has been lost. So all of these things affect the student in many different ways, and just add to that depression, anxiety, feelings of isolation. And as I was saying, with the personal, Michigan, one of my friends is a gymnastics owner. He owns a gymnastics gym up in Michigan, and Michigan has been kind of in the sports world and gymnastics world as being one of the strictest currently for COVID-19 restrictions. So this is just kind of a snippet from their actual guidelines. They have recently updated to, that one says 320. They put an update of 4.1. Not many difference, but the example here in what's going on, which is making it a lot harder in the impact on athletes, is his gym for a long time was not able to even be open, even though in gymnastics in general, um, they are more socially distanced. We are not having to be in up close and personal, and we are not a contact sport. So, the children and athletes, they would not be always in close proximity to one another. They are capable of spreading out in the gym and keeping those, CDC guidelines of that 6 feet apart. Currently, Michigan has now imposed restrictions and regulations that are saying that all these athletes, school aged, 13 to 19, have to be tested on a at least weekly basis. So to even participate, well, the effect of it is that the state is not providing enough or all of the tests for these businesses to test their students. So these all of these gyms, which are struggling financially already because of the lack of enrollment and because of the restrictions and everything else, are having to pay out of pocket to get these tests to test their students and athletes. Some gyms that I've noticed already, there's been just with the circles that I'm involved in, there have been many gyms that when COVID-19 hit a few months later, they had to shut down because they did not have the operating cost to continue. It was too high. They didn't have the finances. They didn't have the help to do that. And they, some of them, like I said, were closed up until maybe a month or two ago, and they were not able to continue. And this is just showing some of the cost and some of these tests in a piece. And this is one example. They're costing around like average of, $25, $30 per. So some of these gymnastics gyms, have 100 plus students on teams. They are usually a little bit smaller, but you are average teams in a larger gym could have between 50 to 100 athletes. So on a weekly basis, you're having to do hundreds and thousands of dollars on tests that are coming out of your pocket just to operate and just to have those athletes be able to be in the gym. I know when I was coaching at the beginning of this pandemic and mostly through midsummer, I was not allowed to be in a gym with my athletes. And even when we were able to, for several months, we could be in the gym with them, but we're not able to spot them or have any physical contact with them. So they were not able to do any skills in progression. They would only be able to do skills that they already knew how to do. And in gymnastics, that will not work. In cheerleading, that's a contact sport. They lift people in the air. And so a lot of places were not able to do the cheerleading. Specifically also in Tennessee, where I am living, there was a controversy for a little bit about they tried to cancel and not let the cheerleaders at the basketball games that they were cheering for their sports team or for their schools. They weren't, they were trying to restrict them from being allowed to go to the events to cheer. It ultimately did not pass, and they were allowed to, return to that. But even at that, they are already traumatized, like I said, by the restrictions of COVID and being isolated, and not being able to practice. And then now, then they're able to go to the events, which most of, the basketball games, if there were any football games played, they are cheering to very limited crowd, if there was even a crowd allowed. So you're cheering, your whole purpose, for cheerleading is to help the crowd cheer on your team. You have nobody to cheer to. So that is a very isolating thing. And a lot of my athletes were struggling with that as well, that, they were feeling it and feeling left out because they weren't allowed to do the same things that maybe some other sports were, even football. They're being allowed to play cheerleading. They're being told that they can't do certain things. They weren't allowed to practice. They weren't allowed to, do the things that they normally do in cheerleading. So this is, having great impact. And again, not a lot of attention has been on this side of, the athletics, or, this group of, student athletes. So, they're having additional stress, additional, trauma, which is leading to, those greater numbers of depression and anxiety. So what can we do as clinicians? Well, a couple guidelines that I had seen and found, and these are Reardon et al. 2019. They suggest, just as general guidance, working with elite athletes, which a lot of these athletes would be considered, that is, just being flexible about the timing of their sessions, and, working with them. Urge for couples or family therapy for relational issues. They are, recommending psychotherapy, and when appropriate, making the recommendations, to the appropriate, for, adding the psychopharmacology, the drugs that, help them with the depression, anxiety, and just kind of, finding out and just giving that general help. They did say avoid, having the coaches themselves in therapy sessions if you're seeing the athletes, and avoid any of the experimental treatments. Trying not to do that, just because it may give false hope to athletes. So, continuing on here, the clinicians, I mean, you got to be mindful about how the characteristics of the athletes differ from, other clients, and how that would impact, the treatment. Some high level athletes, they think differently than other people the same age as them. Their approach is different. There is a lot of different aspects that go in. There might be some more obsession, some perfectionism, the way that they approach things, they may take it in different steps, because of their training. So you got to be a little bit mindful of how you approach them. They also might, and this is a side note that was put in this, that they might also perceive that they are getting or should get preferential treatment because of their status in their sport. So they may be high level, they may be Olympic level, and they might expect, preferential treatment because of that. Not all, but some may. And in some cases, yes, we need to, be mindful of their maybe publicity, and, their profile in in the athletics. Say, what if you were, most people know who Simone Biles is. What if she needed help? Well, on top of, maintaining normal client privacy, you have to just kind of be mindful because media might find out and they might put extra attention onto her, which may increase the level of stress, anxiety, and trauma that she's experiencing. So again, you must be mindful of it, but don't allow that to be, have the boundaries in there. Do not let it get out of hand to where they expect that they will get treated different than somebody else. Also, you may have to start accommodating, different schedules and things as well, especially as they are starting to get back into their actual training and being allowed to train. So some of these strategies and how to approach, getting help to these athletes. The suggestion is, you should include both group and individual therapies. The group therapies, the main thing is, some of these, and a lot of them, even if they are more on an individualized sport, there's still a group dynamic with the people that they train with, their team members. Gymnastics is individual, but they have team members. So the suggestion is having the group therapy and trying to get the whole team involved. And the reason for that is they already have their dynamics and with the way that they interact with each other, the way they talk to each other, the way they help each other. So, that group is replicating the team dynamics. So even on Zoom, even though they haven't been able to meet and be in person with each other, if you have a group session on Zoom, it's not the same, but it's at least trying to replicate that experience where they are seeing familiar faces. They are able to interact similarly that they would in a normal setting for them. So that dynamic is important and it's already established. So something that you should be mindful of. And just taking a note, some of these athletes spend hours training with these people. They are usually with some of these people more than they would be with their regular family. So also then, individual, just be mindful, as clinicians, I mean, most of us know that, you approach the client and, go and counsel to their needs. So same thing with these athletes, that they're going to be coming in with different needs. They're going to have different things going on. So just being mindful of what's going on for individual therapy to go with the appropriate approach. Some of them may be experiencing PTSD. This was a traumatic thing for them, especially those athletes that their program was completely canceled. That's a traumatic event where they're no longer able to do the thing that they have been doing majority of their life in some cases. So that is a major event, a major traumatic event. So be mindful of that and, approach it different ways. I mean, the modalities, there's different things, PTSD with the CBT, DBT. So those are just different things that you can use. Just use what you're comfortable with and what is appropriate to, the situation and, treating their symptoms and helping that athlete the same as you would any other individual. Also, a consideration is consider family therapy. So it kind of like a lot of us, and we, because of the pandemic and shutdowns and everything else, we had been kind of forced into spending more time with our family members because we weren't allowed to go out. Well, these athletes, some of them, they have not been with their family. A lot of high level and elite athletes are usually training in separate states. So a lot of cases, and I'll speak from the gymnastics side of things. I know there are several families that when they hit an elite level, they don't live with their family. They live with surrogate families or dorms, and they haven't seen their family or been to their family since the last time that they had a break, which could be, for a holiday. So they're not spending much time. And now, because of all of the restrictions and all the cancellations and everything else, they're being forced now to spend time with people that they haven't been involved or close proximity to. That can cause a lot of tension. It's already seen that that on any one of us, we've had an increase in family tension and problems due to us being in close proximity with our family during this pandemic. So just consider that family therapy is something that probably should be involved, or it is a good idea to try to get involved, just to help everything else. Again, work to the client and let them, see where the need is. If they some of them might have a great relationship with their family and don't need that. Some don't. So just, be mindful of it though. So there are also, barriers, and a lot of elite athletes. It's noted that they have just like a lot of other things, military as well. They have a stigma of mental health. They don't want to admit, or they're in denial when they experience mental health. So that's definitely a barrier and a challenge. And the COVID-19 might have exacerbated their symptoms, but they are still in denial, or they have a stigma of seeking help, and that is going to increase and just kind of cause more problems. So things to do, I will talk a little bit here in the next slide, but they've with everything, it's also that my athletes, that because of the pandemic, they are also kind of grown accustomed to being isolated and withdrawn. So these dynamics are just increasing and piling on top of each other, and they're exacerbating the problems that are already going on. So one thing that is suggested is maybe reaching out and doing some psychoeducation to some of these teams or athletic departments. So not necessarily just the individual teams, but the department. So talking to the athletes, talking to the coaches, talking to the department reps, everybody that's involved in the athletics, and just giving some broad in general of signs of depression, anxiety, and how psychotherapy might help, or counseling might help, group counseling, how that's going to help them, and giving that education to kind of get that foot in the door, so that they're not as stigmatized by the process and what is going to go on, and might be better reaching out for help individually, And that also gives an opportunity to, work and set up again for that group counseling or, group therapy of working with the teams. So, giving those that education first, and then that opens up and they help for more involvement in their help and treatment, and just having the coaches or the athletic department saying, hey, maybe we do need to focus a little bit more on this and get some help to our athletes, just to help make it a little bit better through this pandemic and work together. So the focus on it is just drawing attention to and getting everybody aware that there might be some issues, and having them try to reach out and be more proactive in seeking treatment, or coaches identifying, hey, my athletes are struggling, and getting them that help. So I'm going to open it up now to any questions, comments, thoughts. Please feel free to chime in and let me know what questions you might have, or comments, thoughts, anything. So again, just opening it up to comments and questions. I would like to know, what is anybody actually or currently working with any athletes? What are some of their experiences? Like I said, I work with athletes, and I work mostly with cheerleading and gymnastics. And like I said, a lot of our programs are still being affected, and that our athletes are having a lot of depression. They are still not being able to, express themselves as well, and the anxiety is, majorly increasing. So with things that I do is I try to talk with my athletes, and just kind of, in times I have the ability to kind of sit down and talk with them and about what's going on in general. A lot of times, they're just talking to them about other things other than their athletics, about what's going on. Also, talking about what's going on in school, family, things of that nature that they are experiencing in life, and just having that person to talk to. A lot of times, something that I've experienced as well, and that would be a strategy to use, is if they're not at first comfortable reaching out to a mental health counselor or therapist, reaching out and encouraging them to reach out to their coach. My experience is that a lot of my athletes will come to me and ask for, my advice, my thoughts as a coach. And this was even before I did any type of counseling. That is actually why I got into counseling. is because I had so many and I was helping them out with different things. So with that, they already have a dynamic a lot of times with their coach. And like I said earlier, a lot of these athletes spend hours. Me personally, when I was a higher level gymnast, I spent 20 to 25 hours a week in a gym. Some of these athletes spend 40 or more hours in a gym. It is a full-time job for them. Those are the athletes that I said that are, training, and they are usually the ones that are training away from home. Those are the Olympic gymnasts, some of the other Olympic sports as well. I know quite a few, training at the Olympic Training Center that, there's a lot of athletes there that are, away from their families and training. So that usually the people that they can go to are the coach, their teammates. So, reaching out to the coaches and, having the students or and athletes reach out to their coaches when they are having some problems as well might will definitely help with the situation. But then that's where that psychoeducation of with the coaches to tell them and help them reach out to other resources. So with the athletes coming to the coaches can provide those other additional resources, that we are able to provide them, get them appropriate help, and steer them in the right direction so that we're not having the situation where it gets too far where they're very isolated and we reach a situation that is coming up into the suicidal ideations, which I said have been increasing. So we want to obviously avoid that. So getting the resources, whichever way that we can, to the athletes is the most important thing. And then separately, like I said, the recommendation from Reardon was that you don't want to work with both coaches and athletes at the same time, that there might be a conflict there. So maybe having an additional therapist, or making that referral for the coach as well, because he or she is going to be struggling just as much as some of these students that and athletes, that they are experiencing the same thing. They're not able to do their job. They're not able to work with these athletes that they have worked with for so many hours and spent so much time. Some of them, would consider that they would be that's their family. That's part of their family. These the other athletes, the other coaches involved, that's how much time they spend with all of these people, they consider them to be family. So reaching out and letting them have that extra support, and being able to give them the resources to help them find the appropriate help through counseling, and additionally, like I said, giving that support to the coaches. So this is a big impact on everybody, and that traumatic events, this may take some time, even though we are getting back into the process of things. They might also be struggling with the fact that they are not up to their normal standard. And a lot of the ones in one of the previous slides, they were having issues saying that they did not know if they would be able to return at the same level, that they were having concerns that being all this time off, that they were going to be out of shape and not be up to the same amount of competitiveness that they were at. A lot of these same, there was major concern with some athletes, with the Olympics, and some of them have chosen to forgo the Olympics because of the delay and the worry that they would not be able to compete at the level that they were or expecting to compete in 2020. And they had trained so heavily for, and now with this extra year and all the extra time, it has thrown off a lot of schedules, and they are struggling with, am I going to be able to compete at that same level? Which again adds to the anxiety, which adds to the depression, and may cause more isolation. I mean, this is, in some cases, with these athletes, this is their job. This is what they do. And this is all they, know at this level and know for the, their life. Some of these athletes have been in this sport since they were little children. And that impact, again, the PTSD is, greatly impacting it. And they need some guidance, some help, and that's, again, we need to be aware of this and make the departments aware, and try to help us, even the ones that are canceled, being able to at least get in there, maybe talk with those departments and get in touch with these athletes and teams and provide some help with that, and how to deal with end of their career in some cases, or helping them work through and get them working through finding other outlets of where they can do the sports, where they can compete, where they might go from there. And just being there and giving that extra support. So that's where a lot, this is the major effects. There's numerous effects from COVID, and more attention needs to be on the athletes as well. Like I said, this is through high school, because everybody's attention is still on, let's reopen in person, and just on the academic side of things. And even though the academics are opening up, not all the sports are opening up. So we need to be more aware of that. And in some cases we might need to advocate a little bit more for that as well, and just the well-being for every student. I mean, that's what we need to do, period, is advocate for well-being, but that additional component. So and one of the I got a question that was just asking, from the counseling standpoint, what have been successful strategies in reducing anxiety in athletes worried about falling behind in their training? And the answer to that is, from what I've seen, there wasn't any specific strategy. There was very limited on the athletes and COVID, the effects of it. And that's why I said that there needs to be some more attention drawn to it. Different strategies, for anxiety, reducing anxiety and that worry about falling behind in the training is just, from what I've experienced and what I've seen, is still encouraging them and getting that group, maybe getting on a Zoom and working out together on Zoom, even small sessions, just to encourage that number one, that team dynamic going on, which we had talked about as one strategy, is having that group and getting that team together, which they are used to. And then it's encouraging them to continue to engage in the sport themselves, even if it's minimal. I knew there were some gymnasts and other athletes that were posting video challenges to their teammates or other athletes, just kind of showing, well, this is what I'm doing during the pandemic, and can you match this, or can you top me? So giving that challenge out to that. So, as from a coach can put out a challenge of them doing something or giving some challenges to their athletes just to keep them engaged. So even just that minimal interaction between, the coaches and the athletes themselves back and forth to each other gives that encouragement, gives them the motivation. So that could be a strategy to help, but there is not a specific strategy that I've seen personally. Any other questions, comments? Any other thoughts on any other strategies that anybody might have used themselves, personal experiences that might have helped any athletes that they have been working with through this pandemic? It got another question was, who seems to exhibit it more anxiety, the college level or the K through 12? Again, there wasn't any specific data on that. Most of the athletes that are, in these level of sports are going to range between the average ages, between 12 and I'd say 25. That is the average for, for athletes and elite athletes. So it would just depend on the sport, I would say. I'd say it's affecting everybody almost equally. The personal experience that I've seen, with youth in general, is I have seen more children in the K through 12 being affected by COVID in general, and just an increase in the suicidality and the depression and anxiety than I have as the adults being affected by it or admitting that they were affected by it. But again, I would just say both would be the best answer, that everybody's being affected by it. I don't have anything that I have seen personally or found that could say that it's, college or, high school level that is experiencing it more. I believe it is just as equal. It just depends on the situation. Again, a lot of the cancellation is happening more in the college level. So depending on their situation, I would say that, they might be experiencing a little more than high school students in the same sport some of that time. But again, then equally, in certain sports, in high school, they're not able to practice as well because the school's being closed, or in even the private institutions, gymnastics gyms, they cater to both high school and college level in some cases. So I would say that it's fairly equal across the board from my experience and what I've seen so far. And like I said, I haven't seen any real hard data on it. There's limited data on some of this as it is currently, and that's where again, and more attention needs to be paid to it. Do we have any more questions or concerns? I think we are wrapping up here and getting to the end of it. So if there's not any more questions or concerns, I do want to thank you for listening to me and giving me the time to show some awareness to this, and shed a little bit more light on the need for the focus for focusing on athletes and the effect that this is having on athletes, and it is continuing to still have on them, even though we are trying to get into a phase of reopening. This is still being affected. Those, like I said, those Michigan restrictions, which are causing some more problems with certain athletics, that is current. That is not something that has been last year. This is still going on. There is still restrictions going on, and that are still having an impact. So I do thank you for listening to me, allowing me to talk to you, and hopefully we can go advocate and do better for our athletes and students in general. Get that focus back on to the well-being and growing the mental health and helping them through all of this ordeal.